Reflexes now. Plantar reflexes, there are three ways for plantar reflexes. This is the first way, extension of the foot, and this is the tendon, and we hit the tendon by the hammer. سوي ده الجر reinforcement ده نسوي للمريض. اوكي بسيطة. That's here. Reflexes, positive reflex after reinforcement. Okay, this is one way. The other legs is also the same, and this is the second way of reflexes. Also, this is the plantar reflexes. The third way is this way. The third way of reflexes this way. Okay. Okay, this is the plantar reflex. Reflex diminished or even lost in elderly. This is normal. If it is exaggerated in elderly, it is pathological. Absent in young age is difficult. Suspicion of probably a disease. The second reflexes is of the superficial reflexes is abdominal reflexes. This is the plantar reflexes. This is the plantar reflexes. This is the way of plantar reflexes. Normally, downward and closing each others. This is normally downward and closing each others. The abnormal حركة اللي فوق ده هذه حركة اللي فوق هذه فوق. Fanning and abnormal. This abnormal reflexes of plantar reflexes, we see it in coma and upper motor neural lesion. Sometimes the reflexes is downward one. After that, after a few while, it is upward one. This is equivocal. We have to repeat it many times until we settle on. Sometime without any reaction. Many times we do without any reaction. This is negative plantar test, usually seen in paralysis of S1. The hallucis longus muscle supply this plantar reflexes is paralyzed. The second superficial reflexes is the abdominal reflexes. This is the way of abdominal reflexes. Acroreflexes. Okay? The superficial reflexes, these are plantar and abdominal reflexes. The deep tendon reflexes, we did the ankle, and now we did what? The knee. There are two ways to examine the knee reflexes. First of all, we just put the leg in this position and we find the ligament and we hit the ligament. Okay? This is a positive test. Usually, normally, هو brisk. If it is diminished, abnormal. Usually brisk. If it is diminished or lost, abnormal. Contraction of the quadriceps muscles. This muscles, contraction, and you get reflexes positive. If it is hyperreflexia or hyperreflexia, we should do after that what? Clonus. If we see the knee reflexes is hyperreflexia, then we did clonus of the patella this way. And if it is positive, it's just like this movement. Usually either sustain or non-sustain. Non-sustain, 1, 2, 3, and stop. Sustain usually more, just like this movement. And the other way of this way. Also you get contraction of the muscle, movement of the muscle, clonus. Okay, this is the knee, the ankle joint, and the patellar and the abdominal. The other tender reflexes is reflexes in biceps and asabia. And over the umbilicus in this way, and we searching for the tendon of the biceps, and we do it like this. You get contraction of the biceps, flexion, contraction of the biceps. She had this muscle had two heads, and then the supinator. Either we hit the muscle. Yes, contraction, and or we hit the tendon. Okay, this is the supinator reflex, and triceps muscle this way. Okay, triceps muscle. These are the tendon reflexes and superficial reflexes. The nerve supply of the tendon reflexes for the ankle, knee, biceps, triceps, and supinator, and the abdominal reflexes are 1, 2, S1, S2, and sometime L5, 1, 2, 3, 4, lumbar, 5, 6, 5, 6, 7, 8, 8, 10, 8, 12, sorry, 8, 12. These are the level of the reflexes. Now we sometimes some examiner asking for reflexes in the face. What are the reflexes in the face? Reflexes in the face. The first reflexes بالفيس هو الجلابيلر تاب. This is the way to examine the glabellar tab. Normally, when we hit the frontal area, we get blinking of the eye once, twice, sometimes thrice. After that, they accommodate. They didn't blink. If the patient is blinking all the times, this is usually seen in positive test and seen in Parkinson's disease. Okay? This is glabellar tab. It go with what?
5.
In the trigeminal, ophthalmic branch of the trigeminal, and return back by facial nerve. All the closure of the eye by facial nerve. The second reflexes in the face is corneal reflexes. We touch the cornea. Yes. It go with the trigeminal.
Come with the facial.
Coming with the facial. This is what? We touch what? This is the conjunctiva. Is also go with the fifth and return with what? With the facial. As a light accommodation and light reflexes and accommodation reflexes. Light reflexes this way of the light reflexes. This way. From behind the ear until we come close to the eye, we see contraction of the eye, pupil. The second way, we see the other. This is direct and this is consensual. Accommodation, this is, look to the tip of this pen. Tip. Get conversion and then contraction of both pupil. That's it. That's this. Both of them go by second and return by the third. Okay? The other reflexes is what? Is jaw jerk reflex. Open your mouth, not fully open. لا تفتحها. افتحها بالله fully. Not this way and not this way. This way, midway. And we hit. Normally there is a clinch. Normally there is no reflexes. Normally negative. But if there is a clinch, it means that the lesion
upper midbrain.
in the midbrain and above the midbrain. Because it go with the fifth and retain with the fifth. And the fifth cranial nerve nucleus in what? In which area? In the bones. Gag reflexes, we hit the posterior and then get gag reflex. It go with the 9 and return with the 10. these all reflexes in the face. Okay, any question?
No.
Okay, stop.